So hi, welcome everyone. This is our final session of the Quality Improvement for Our Patients, People and Planet Week. And we've had around about 15 presentations from colleagues across 9 different organisations. And we've heard all about the work you've done. And we've heard that it's all the same goal, quality improvement for our patients, people and planet. We do hope that you found this week useful. We hope you've taken lots of reflections away and you've got lots of things to take back into your practice. And we hope that you find the final session just as useful today. We are going to be talking on 3 occasions today from our partners who have been involved in the week so far. So there's myself from the Fab Academy, and we'll be talking all about Fab. And then we've got the lovely John Wilkes and Elaine Mead from the Institute of Health and Social Care Management. And then we've got Kath Richard, Rachel McLennan from the Centre for Sustainable Healthcare. So one of the things I'd like to start with is housekeeping. So if you could keep yourselves on mute unless you are talking, if you could have your cameras on or off, but we'd prefer if you have it on just so that we can have a bit of interaction so I'm not talking to a blank screen. Please do use the chat function in the Q&A and please do raise your hand if you've got anything. It's an interactive session today. We're not going to bore you with just presentations, so please do get involved, ask questions, and we've got a few interactive parts later on as well as we go along. So what is the Fab Academy? So is there anybody here who doesn't know what the Fab Academy is? Has everybody heard of the Fab Academy? Just raise your hand if you have, a thumbs up or... Yeah? Fab. So...
Oh, sorry. No, I haven't.
You haven't? Right. So that's what this is all about then. So I'm going to tell you a little bit.
Briefly, I'll catch on.
So that's fine. Don't worry, because that's exactly what I'm here for today. We are here to tell you what the Fab Academy is and how we can be utilised by yourself, what we're there for, and how you can get involved as well. So the Fab Academy started on the 14th of February 2015. It was founded by Roy Lilly and Terry Porritt, and it became a social movement. And in the end of about 2015, we got more and more healthcare and social care members. A part of it, we started sharing best practice and we started to work together with organisations across the UK and up to today we're across the world as well. And the idea being is that back when kind of 2015, there was a big thing around quality improvement, working with Trust on QI, and it was very much a me. I'm doing this. It was very isolated, very kind of working in silo. And what they were finding is that people down the road were doing exactly the same thing or trying to do exactly the same thing. But unfortunately, they weren't talking because they weren't aware of it and they weren't aware that other people were doing it. So Roy had this idea of trying to make it a little bit easier to share best practice, to share QI and transformation, network with others around the UK to try and help people not reinvent the wheel. So it's not just about sharing their ideas, but sharing the solutions, learning together. So if somebody down the road is thinking, I'm going to change this today, and somebody further up the road is doing something very similar and have had a few hurdles and a few barriers along the way, rather than trying to fail at the same things or try and succeed at different things, let's get them together, let's get them chatting, let's have a look at a kind of directory of things going on, and hopefully try and save money, save time and save energy on kind of working together. And it's all about pinching with pride. So we're very much around kind of, seeing what's already out there and saying, I like that, that could work in my area. How can we network with the person that's done that QI, and how can we then move that within our own organisation as well. So we have a little thing with the Fab Academy, and blonde isn't just a hair colour, it is a state of mind. So we like to think of the blonde of our kind of ethos of Fab and what it means to be a part of Fab and what it means to kind of do the things that we do. So B is believe in the importance of what you do, because what we've got to remember here is the Fab Academy isn't myself and Terry and Rachel and Roy. The Fab Academy is you guys. The Fab Academy wouldn't exist without you guys. we wouldn't be sharing best practice without you guys sharing those best practices. And the little things matter. So when we look at the little things, when we're talking about some of these transformations, we're not talking about huge system changes or huge organisation changes. We can be looking at ward level, we can be looking at little minute services, we can be looking at job descriptions and the way that we, and ourselves as well, on how we can try to change those little things. And actually we really can make a difference with that. And it's an opportunity to make fab stuff happen. So it doesn't matter what role you have in health and social care. It doesn't matter where you are in kind of an organisation. We've all got a priority in making sure that we do the best that we can for our service users and the patients that come through that organisation. So actually, it doesn't matter who we are. We've all got an opportunity to make things happen. And some of the greatest ideas have come from people outside of outside of kind of a ward base or outside of that little unit, because you've seen it with a different eyes compared to those that are working in it. And never underestimate the power of sharing. So by sharing the good practice, by sharing the QI, by sharing things that maybe haven't worked out, we don't call them failings, we just call them next opportunities. So something hasn't quite worked out, so how can we work with other people to make something that little bit better, and how can we get it to kind of improve things without re-failing at those same opportunities. And determination to make it happen. So we've all got a passion inside of us. We're all in health and social care because we want to be here. We're all here because we want to make a difference. We've all got that passion within inside of us. And I think when we have that determination to really get things moving and get things changed, we can have a real good passion and excitement to get there. And that's where the energize and engage comes from. So let's energize other people. Let's bring other people along. Let's lead other people into those changes. And if you are a senior leader, or you are you are a leader within your organisation, harness that energy and harness that determination from colleagues and from those who are in a less substantial role than yourself, and get them up and get them moving and making them have that opportunity as well. So start
Danny,
sharing and learning.
I can see a hand up. I think it's Tanya's. Tanya, would you like to come in?
I think you're on mute, lovely.
Sorry, I'm trying to be succinct, but I'm not very good at that.
Don't worry.
I know you mentioned everyone there, but also service users of these systems. Yeah, I think you know what I'm saying. Just saying that it's like not just top down, bottom up.
That's what FAB's all about. It's bottom up. It's grassroots
so for, like,
social movement.
To come and say, hang on, this would make it easier for us. And
absolutely. And Rachel, who is our social media manager for the FAB Academy, she's a patient service user herself, and her entire role is around Rocking Two Stomas on Twitter. And she does a lot of campaigning and works a lot with trust around that. So this is everybody. We've got service users, we've got senior management, we've got porters, we've got domestics, we've got nurses, we've got doctors. You name an organisation, whoever walks through those doors, we have on board within our networks, and we welcome within our networks. So start sharing and start learning. So it's a really easy concept. It's not hard. There's no subscription cost. It's completely free. Everything we do is completely community-based and free to access. We've got different sorts of things happening across our regions as well, so they're all shared. And it's easy enough just to sign up onto the website. If you utilise the links, we've got a virtual postcard that we will be sharing at the end of this, and you can click on any of those links. And literally right at the very first page, you scroll to the bottom and you come up with that, and that's all the details we need, and then you can register. To search, you don't have to register. You can search the website without registering, but if you register, it just means that you can share your own ideas. You can network because you can access some of the contact details within the people's kind of shares as well, so you can network a bit easier. And at the moment, we have around 2.5 million hits on the Academy website, and we've got over 4,000. I think we're closer now to about 5,000 shares on the website of different QI projects, different ideas, different changes. and just different thoughts as well. So even if you haven't necessarily come up with a solution, but you're thinking out loud, they're the kind of ideas that we want. It's not 5,000 words. It is literally a few pictures and a few words just to explain what it is that you do, and we will upload that for you, and you can access it easy enough as well from there. So social media, we've got Twitter, we've got LinkedIn, and we've got Facebook. We have a regular updates and shares on there, so all of our shares get regularly done. All of our news and updates and bulletins all are up there as well. And we've got lots of ideas and thoughts. People network that way. People ask questions. People bring up on, you know, if something's been shared, oh, I like the idea of this. Can I get in touch with whoever has come up with it, and we can link them in. So we've got quite a lot of reachers, and we've got quite a lot of followers. So we have got a really, really good network. So if you haven't got an answer, I can guarantee that somebody within our network will have an answer, or at least the start of a solution for you, to help you look forward to whatever it is that you're doing. And we have regular Fab Changes as well. So this year we've got Fab Changes 22 to 23. And Fab Changes was developed in 2014, and it was NHS Horizons who did NHS Change Day. And in 2016 we took over, and the Fab Academy have done that ever since. Every year it's been a day, it's been a week, it's been a month, and this year we've taken an entire year. We completely understand how burnt out people are and the pressures at the moment. So we wanted to re-energise, reconnect people, and we wanted to try and help people along their journey. So it's taking pledging into a reality and moving that forward as well. So uploading your Fab stuff, again, it's really easy. Up to 500 words, 5 images, a 2-minute video, a poster abstract, or send it to us via email. All the contact details are on the website, and we can upload it for you, and we can add it in. And it's really, really easy. And like I said, there's no cost to it either. It's a completely free thing to do. And then searching. So searching at the top of the screen on the homepage, it just says Fab Stuff. If you click on Fab Stuff, you will come down with all those boxes that you can see on the screen, and then you just search in categories, or if you're looking at a particular type of thing that you're looking for, or just to put in some of the words as a part, and it will narrow it down and bring those. So you're not searching through 4,000 different shares. What you are searching is for specifically what you're looking for, or an idea that you've got, to see if anything out there is already there. So again, it's all health and social care in the wider networks. It's staff, volunteers, patients. It's very much Pinch with Pride. Those that have put it up and shared on the website are specifically there to share and to pinch, and to network and get in touch if you wanted any further information about it, and then replicate it with, you know, without the same kind of barriers, without the same failings, and replicate, you know, the successes. And again, network with those who have tried and tested it, and don't reinvent the wheel. We're a very big believer in don't reinvent the wheel. Save yourself time, money, and energy in just doing something what somebody's already done, rather than trying to get there and do it yourself. So we've also got Fab Collections, and I've popped up there the QI for Patients, People and Planet page. And our Fab Collections are, they are campaigns, they are Fab news, and there are festivals and the like this week, where you can catch up all in one place. So all the videos from this week will be on that Fab Collections. Again, it's just a tab at the top of the homepage, and it will come up with over 22 different themed collections. Everything from Fab and other organisations are all there. Some of the campaigns that have been going on are there as well. All of the resources and information that are associated with that are all in the one place. So Hello, My Name Is, for example, Who's Shoes, NPJ Paralysis, and then there's different organisations who utilise it as their platform as well. So we've got the ESIS team, they've got their very own collection there as well. So anything that the ESIS want to do, or they want to share resources, they put it all on there for everybody to see, but also for their organisation to be able to find in one place. And like I said, this week is also there, so you can see there just the pages that are on there just at the moment, explaining what the week is and the agenda. And then if you click on the links, it will come up with any of the resources, the videos, and any presentations or anything that's been shared by people as well. So it's all there, and again, easy to network with, and you can look through at your own pleasure as well. So Fab Ambassadors, so these are over 100 people across the country and the world. We've got Holland, we've got New Zealand, we've got Canada, and we've got Australia, and they're volunteers with a highly diverse skill set. They come from a wide range of organisations and professions, and we are here to lead the future with enthusiasm, positivity, knowledge, and hope. And the main part of our kind of network and our family is that, you know, we've all got a passion for QI, we've all got a passion for service improvement, we've all got a passion to make sure that the care that's provided from any of our organisations is the best care that it can be. So we keep ourselves going, and we keep ourselves kind of moved with things, and we can ask questions. But we are also there across the UK in all of our regions, right from Scotland down to Dorset and Bournemouth, and we are there as kind of like the networking region. So if somebody within an organisation or a region wants to connect with somebody else in that region, then we can connect them up, and we can we start to bring those networks together. So you're not trying to email anybody and everybody to try and find out who's about. We can do that for you, and we can say, you know, come with us with whatever your idea is. So somebody, for example, asked recently about DNA CPRs and doing a policy around that, and the signing off of DNA CPRs. And we just got an email saying, is anybody else doing anything like this? And we were able to very quickly link her in with 2 ambassadors, and then they were then very quickly networked in with other networks that are doing work around that as well. So within a couple of days, they had everything that they needed from a network point of view. They're very solution focused. So if you come to us with something that you're not quite sure about or you want to work with, then we can work with you, and we connect people all over. And we work on Fab Change as well. So we work predominantly on Fab Change. So a little bit about Fab Changes. We are in the running now. We are Fab Changes 22 to 23, and it's a year-long plan. Again, on the Fab Collections, all you need to know is there, and we're here to develop your ideas. We're here to help you with those and make them a reality. Everything from practical steps to celebrations thereafter as well. So that is myself. So thank you very, very much for listening. We have the lovely Kath next, who is going to talk about greener sustainability. So thank you very much for listening to me. And Kath and Rachel, do you want to introduce yourselves?
Thanks, Danny. Yeah, lots of interesting, lots going off in my mind in terms of how we can collaborate and kind of use the Fab space as well to link people up. So thank you for that. That's a really great presentation. Welcome everyone. It's really great to see so many people on the call again. We've had such great attendance at all these sessions, and it's just amazing to see so many people again. So my name is Kath Richards. I work for the Centre for Sustainable Healthcare, and I'm in a relatively new role in as SUSQI programme lead there, which I'll talk a little bit about. And my colleague Rachel McLean is on the call as well. If you want to wave, Rachel, or say hello.
Hi everyone.
And Rachel also works for the centre and is the Green Wards programme manager. So I'm going to share some slides. But firstly, just to say really how incredible this week has been to bring everyone together, and just how many people have been at the sessions. It's been a really great week of events, and just a massive thank you to the team of organisers, and obviously particular thanks to Katie and Nicola for bringing this all together. There's so much work has gone on in the background, and it has been such a great event. So thank you for that. So I just wanted to just talk a little bit about the Centre for Sustainable Healthcare, sort of who we are and what we do. So the Centre for Sustainable Health was established in 2008, and that was at a time where founder Rachel was working with Samuel Gray, who also at a similar time set up the Sustainable Development Unit inside NHS England, so which is now the Greener NHS. And really because they realised there wasn't a huge amount of work going on at the time around looking at sustainability in healthcare and the impact of climate on health. And the centre was set up with the purpose to engage healthcare professionals and patients and the wider community really around the connections between health and the environment, and to help, overall help reduce healthcare's resource footprint. That was the sort of the purpose of the work that the centre does. And the reason why the centre sits outside of the NHS is to include that broader context as well. So we do a lot of work in healthcare education with academic institutions, and work across, in the same way that FAB do, sort of across the country, in Wales and Scotland as well. It's not just NHS England, and internationally as well. Been going since 2008, as I say, so a lot of the people that work within the centre have real expertise in this area, and a lot of the work we do is around education, providing that expertise, and also providing the practical tools and examples of how to do this work. So there's that kind of experience there of how to do this. And just to say that the work is guided by four main principles. So all the work that the centre does is guided by four main principles, which is prevention of ill health in the first instance, patient empowerment and self-care, lean systems of working, and low carbon alternatives. So they're the four main principles of sustainable healthcare that guide everything that we do. And just to say, for anyone who doesn't know as well, we have a wonderful green space team as well within the Centre for Sustainable Healthcare who do work around green space within hospitals across the UK, and also linked to the NHS Forest, which some of you might be aware of. That's just a little bit about us. In terms of sustainable quality improvement, so one of the things that the centre has developed is the sustainable value equation, and the model of sustainable QI, and the process of sort of embedding the sustainability principles into quality improvement, and also what they've done is develop tools to sort of really practically apply sustainable approaches to quality improvement. So as you can see here on the screen, this is the sustainable value equation. And really it's quite straightforward. It's around, if we want to do a project focusing on sustainability and reducing sustainable impacts, it's taken into account all of these considerations. So if we want to do a project around reducing waste, we still want to make sure that we're not having a negative impact on patients and that patient outcomes are still at the forefront, and if possible outcomes for populations as well. But similarly, and this is, I think, one of the themes that have come out of this week, that sustainable principles can apply to all QI that we do as well. So that if we're doing a project, and most QI, and hopefully most QI, focuses on the outcomes of patients, but we can also apply the lens of looking at the environmental impact and the social impact to those pieces of work as well. So that's the sort of sustainable equation, and it is just about applying this, and it's about a balance between all of these things. So sustainable value is a balance between having the best outcome for patients and populations, also making sure that we don't harm the environment and we don't have negative social impacts, or negative financial impacts as well. And if in fact, we enhance those things. So I just saw something come up in the chat. So there is a link to the article. I think Rachel's put it in the article, in the paper around the sustainable value equation. So I do encourage people to have a look at that. So in terms of this week then, so these are just some of the reflections that sort of we've had to think about, and some of the things that have come out, that just sort of reflect on the sessions that some of the conversations that came through the sessions that we ran, and also through the other presentations. First things first was just such a wide range of people that have attended. You know, we've had lots of clinical staff, we've had quality improvement staff, we've had really senior managers and leaders, sustainability staff, so just a huge wide range of attendees. And I think that's what we need to kind of, you know, really embed sustainability into our organisations, and the improvement we do is everyone being on board with this approach. So that's been really great to see. The other thing really is that already just acknowledging the huge amount of work that's already been done and the wide range of work that people are focusing on. So this is already happening, you know, there's no doubt that and it is just about linking people up together, and doing that thing that you're talking about, Danny, around not people doing the same things in different spheres, and kind of linking people. And that's what this week's been amazing for. And again, thank you to Nicola and Katie for getting people together to share their work. Yeah, confident that this is really already happening. In terms of how we understand and communicate environmental impact, so that was one of the conversations that came up through the session that we did on Wednesday around environmental metrics, and metrics when we're looking at sustainable improvement. We were talking about how you measure that in the first instance, but then how you communicate it, because for lots of people CO2 equivalence doesn't necessarily mean anything. So how do we communicate this better? That was something we had some conversations around, how we can do that with each other, but also really the importance that we are measuring this, because how do we know that we're improving if we're not measuring it? So, you know, how can we do that as a community, and how can we share knowledge around how we are measuring that? The importance of challenging and engaging others. So there's a comment, I think, and a conversation around sort of how we go about this, how we get senior leaders on board, and how we engage and have those conversations. And I think, you know, by sharing the work that other people are doing and sharing case studies and sharing examples, that's a really powerful way. And I think it was Sophie who has really started to are embedding sustainability in all QI they do in Leeds, was saying that she asked for forgiveness rather than permission, which I liked. So yeah, just certainly the importance of engaging others, because we're all here and we're all engaged, but how do we get other people on board? And that really important thing around linking, you know, clinicians, QI, people who work in QI, and sustainability in teams as well, and how to do that effectively. So those are the sort of things that were coming out for me. And I sit at the Centre for Sustainable Healthcare. I wanted to just ask and give people an opportunity to write in the chat anything any reflections, really, anything that you've reflected on from the week, if you know, from any of the sessions you've been at, what things have come up for you, and just type that in the chat. Just have a think about it, just type it in the chat. Or if there are any questions for myself or Rachel, please do type that in the chat. We might have a chance in this session to answer them, but if you do have any questions you want to ask, pop them in the chat, and either we can try and answer them through the rest of this hour, or if you leave your details, we can try and get back to you as well. So just any reflections anyone has from the week, and also any questions that you might have, this is an opportunity. And we will leave our details at the end of the session, like we have throughout the week, if there's anything after it as well. But I'd be really interested to know sort of what people's reflections are. So I'll just let you do that as I carry on. So I just wanted to end on this slide, really. So this slide is something we use for the training, but to me it perfectly sums up how QI helps us to take the knowledge that we have about the need for sustainable healthcare and gives us the tools to do it. And we're all here for this week in this session because, you know, we already have the knowledge that there's a need for healthcare to be more sustainable. And the week has allowed us to share real practical examples about how people are using QI to turn that into action. I think as a group, you know, we're there really. We know what we need to do, and we really know how to do it. And I think one of the sessions, just reflecting on a session that I went to yesterday, which was Somerset's project around nitrous oxide. I mean, all of the projects that have been shared throughout this week have been just an example of exactly this, taking the need that we need to do something and putting it into action. But the project, I just think it was that perfect example of it all coming together. So this real need that we know that we need to do something around nitrous oxide and we want to reduce it. That perfect mix of the clinicians on the ground that really know what the impact could be for patients, and knowing how, you know, how we could do this, how we need to do it, and then the sustainability and the estates team really getting on board to be able to practically do that, and then the QI kind of tools, the QI team who'd obviously been involved to really support the process around it. It was just that perfect example of this really in action. And I think just to leave on really that I think we know as a group of people that sort of we've got the kind of knowledge and the tools now to do this, and there's so many great examples of those individual projects. But I suppose the sort of question now we need to ask is how we embed this further. So how we take that from individual projects to making this is about how we do all improvement work and embedding sustainability into all improvement work. So, you know, I think it's a question for all of us, and something, you know, I think hopefully we can all work on together as a community. Again, for anyone who didn't listen to Wednesday's session, I think Sophie from Leeds Teaching Hospital gave some really good examples about how they're already embedding it into their work there, which I think was just really inspiring around how they're already doing that, so that every QI project, piece of improvement work, has the sustainability elements through it. Do listen back to that if you didn't get a chance to. Have I run out of time? The only other thing that I was going to do, someone tell me, was just share where you can find some resources from the Centre for Sustainable Healthcare. I've got a tiny bit more time, but I'll just share this quickly. If I change my screen now, so I just want to, we'll pop a link in the chat, and then also at the end of this end of the week, I know we're going to send out some resources, but this is the website, sqi.org, and on here there's just lots and lots of resources for people who practically are trying to do sustainable QI work. So we've got, if you want to do a project, there's a step-by-step guide here to support you to do that, and there's lots of open resources on here. If you're teaching quality improvement, there's some really good resources around how to kind of embed sustainability into that. And then other offers of support that we have at the centre around, we've got SSQI Academy and our beacon sites as well. So please do have a look on here. And the other thing is case examples. So the one thing about sharing and kind of getting that message out there is having really practical examples. So we've also got on here lots of really good case studies for you to be able to share as well. And I'm just thinking, Danny, with sort of how we can link things up with the Academy as well, to kind of think about how we can work together really. And then the last thing, just really quickly, because I know I'm running out of time, is just to talk about our networks. So we have a range of networks, both profession specific. So for example, we've got AHP, occupational therapy networks, but we've also got specialty specific networks as well. And again, that's a place to share, link up with people who are already doing work, examples, sharing, not reinventing the wheel, and communicating, networking with each other. So I just wanted to show you those few things. I'm going to end now and stop sharing and pass over to John and Elaine.
I'm just going to come in very